Hi, I'm Dr. Madison. I'm one of the chiropractors here at Lunt Chiropractic, and today we're going to go over upper cross syndrome, which is something we see quite a bit in our office. What it consists of is typically people lean forward a ton when they're sitting. This creates a lot of tightness across their chest, that forward posture, forward head carriage, and then that can cause a lot of that aching in the upper back as those muscles in the back are over lengthened. It can also just present in a lot of upper back pain, a lot of stiffness, headaches from those muscles getting tightened through the upper neck trying to hold yourself back, and a lot of difficulty almost getting back into that upright position. So treatment for upper cross syndrome is gonna kind of follow the lines of any upper back tension treatment that we typically see or typically do at the office. So we would go through feel for where we see a lot of the tension. We do a little bit of that pin and stretch. So what I do is that I'm just gonna pin down the muscles as they attach through the scapula here, and I'm just going to bring her arm forward and back to get a nice stretch through that area. And mostly the muscles through here, the traps, the rhomboids, those are the ones that we target. And especially as we get higher up into the upper trap, the levator, those attach up into the neck muscles as well. So just feeling through that neck musculature, and then just kind of, again, doing a little bit of pin and stretch each side. And while we do this, we do a little bit of traction too, just to get a really good stretch through there. Does that feel okay? Most headaches from tension, and a lot of that is going to come from your suboccipital muscles, which are right at the base of your skull here. So getting to pull up and then press up into those muscles can really help to loosen them up and relieve some tension. People that we see come into the office that have upper cross are more people that have desk jobs, anything that they're really sitting a lot, so truck drivers, things like that. And then a lot of kids that do video games, texting on your phone consistently can cause a lot of that forward position. So an exercise that we typically give at home is called the chin retraction. So as far as the chin retraction exercise, we would have them sit up straight. We want to think about retracting our chin straight back. We're going to look down to tuck our chin slightly, and then we're going to press back farther. This helps to alleviate a lot of tightness at that CT region that I mentioned earlier and at the base of the skull, or those suboccipital muscles. And then holding the position for a good 15 to 20 count is going to present a really good stretch in through that neck. Another thing that we see with upper cross is that when we're fixing our posture and trying to do shoulders back, sometimes that feels a little too exaggerated for some people. So another good cue that you can try is just dropping your shoulders a little bit, feeling upright, and then actually tucking your ribs down a little. It might sound counterintuitive, but it's actually going to engage your abs, keep your pelvis in more of a posterior tilt position that's a little bit more comfortable when you're sitting or standing for a long period, and then also help reduce you leaning forward again with your head.